So, when you think of health science, you're probably picturing, anatomy charts, maybe some intense chemistry labs. But today we're doing an explainer on something totally different. We are looking at the CTV H Science final exam for the year 2083, specifically the English paper. We're going to decode exactly how testing vocabulary and literature is secretly training the next generation of compassionate, clear communicating healthcare providers. All right, here's our roadmap for today. We're looking at 5 key areas: decoding the CTVT exam, professional medical writing, literature and clinical empathy, technical English and grammar, and finally, the holistic healthcare provider. It's quite the journey.
Section 1. Decoding the CTVT exam, a diagnostic breakdown. Let's get right into the big picture of this 2083 final exam paper and check its basic vitals.
So the magic number here is 80. The test is out of 80 total marks, and students need a 32 just to pass. Oh, and they've only got exactly 3 hours to prove they know their stuff. Talk about a high-pressure environment, right? It's literally like a busy clinic. They have to quickly pivot between some radically different types of analytical thinking to succeed. This perfectly captures the dual nature of the whole thing. On one side, you have clinical precision, multiple-choice questions, strict grammar rules. But on the other side, human empathy, tested through literature and essay writing. It's not just about, knowing where to put a comma. It's about actually knowing how to talk to a human being. Moving right along to Section 2, Professional Medical Writing and Real-World Healthcare Applications. Let's throw the essay section under the microscope first. Check this out. Students have to write a 10-mark job application and a short CV for one of 4 specific roles: staff nurse, health assistant, lab assistant, or pharmacist. This isn't some generic what I did on my summer vacation essay. It directly mirrors the exact paperwork these folks will be submitting the second they graduate and hit the job market. Then the exam throws a total curveball. It asks this massive, heavy ethical question: will lab-prepared organs open new avenues of medical science, like spare parts for cars? Because as a healthcare worker, you're not just dealing with biology, you're navigating complex bioethics. This prompt forces them to articulate a really sophisticated argument about the future of medical tech. To wrap up the writing portion, they have to bang out a 300-word public health essay, pushing preventative care, stuff like walking, yoga, and physical exercise. It tests their ability to take standard health advice and package it compellingly for the general public. It's basically a dry run for real-world patient education. Section 3. Literature and Clinical Empathy, the Human Element in Medicine. Now, this is where things get really fascinating. We're stepping away from hard science and right into the messy reality of human emotions. Referencing the story of the use of force, I gotta ask you directly, how would you handle a terrified patient in your clinic? I mean, we've all been that nervous patient freaking out over a needle at least once, right? It's an incredible way to test real-world conflict resolution using a fictional scenario. The student really has to step into the provider's shoes and manage sheer panic. And it's not all strictly clinical either. Stay hungry, stay foolish. Students actually have to interpret this famous phrase. It proves they can grasp those abstract, motivational concepts that go way beyond standard medical textbooks. Healthcare requires a mindset of lifelong learning, which is exactly what this evaluates. Just look at the staggering variety of human experiences they have to analyze here. From societal critiques in Lunatic to animal cruelty in The Parrot in the Cage, they're tackling friendship and betrayal in Malini, and even normative versus cohabiting relationships. Why? Because a health worker treats the entire spectrum of society. Understanding these themes builds the cultural competence you absolutely need to treat people from all walks of life. Take question 3K, for example. Why was Andrew feeling particularly heavy and muddled in his thoughts during the night call in birth? By asking this, the exam is actually testing a student's ability to empathize with provider burnout. It is a very real, very sobering preparation for the immense physical and mental toll of those high-stakes overnight shifts. Then there's question 3A, asking about the doctor's initial impressions of Matilda and her family. The crucial takeaway here? Diagnosing a character's initial impressions in a short story is literally direct practice for reading a patient's body language in an actual exam room. It sharpens that real-life diagnostic intuition. All right, on to Section 4, Technical English and Grammar, Micro-Level Precision. Because empathy is vital, sure, but in medicine, ambiguity can be downright dangerous. In the multiple choice section, it's all about specialized terms.
like knowing that cardiology focuses strictly on the study of the heart. These aren't just vocab words to memorize, they're the absolute building blocks for accurate medical charting. They also have to nail down exact psychological symptoms. Take MCQ 13, defining euphoria as an elevated mood and excessive happiness, not just, say, having a lot of energy. A misclassification there could completely derail a patient's psychological diagnosis. Precision is literally everything. The vocabulary even gets into some incredibly heavy socio-political territory, asking students to accurately define genocide. Healthcare professionals are often right on the front lines of global crises and human rights issues, so they need a vocabulary that can capture, well, the darkest realities of the human condition. Think about it. A single misunderstood preposition or the wrong tense could actually lead to a serious medical error. That's exactly why 20 entire marks are dedicated strictly to grammar mechanics. Whether they're shifting sentences into the passive voice for objective reporting, or mastering past perfect tense to record a medical history, these rules are essentially the safety rails of clinical documentation. This one is absolutely brilliant. Bedside manner is literally tested right here. Students have to identify which sentence is the most polite, realizing that "could you tell me your name" is the best way to ask. You can have all the medical knowledge in the world, but man, if you alienate your patient with a blunt, commanding tone, you've already failed at healthcare. Finally, Section 5, the holistic healthcare provider, bringing it all together. Let's look at what this all means for the actual future of healthcare. This whole exam just proves that learning English and health science is not just about passing a test for 80 marks. It is about building a toolkit for flawless, truly compassionate patient care. That student analyzing poetry today, they're the practitioner who's going to pick up on your subtle anxieties tomorrow. The one sweating over prepositional logic is the nurse making sure your medical chart is 100% accurate. So ultimately, if language shapes how we treat each other, how will mastering these diverse English skills change the way these future healthcare providers treat you? The next time you walk into a clinic, you kind of have to wonder, will your provider have the precise vocabulary to chart your symptoms and the empathy to ease your fears? Or better yet, if your own doctor had to sit down and take this exact English exam today, would they pass?